Governor Hogan warns that this weekend and next week will be one of the most dangerous times for our region since the pandemic began. The good news, the governor says the steps we've been taking to slow the spread of the virus seem to be working. WJZ investigator Mike Helgren has the details.
Anna Screese was known as Mom by many of her students. The longtime high school Spanish teacher is now one of Maryland's latest victims of COVID-19. The beloved grandmother died suddenly after testing positive.
She was a true humanitarian, and sometimes I take selfless to a fault.
Maryland's confirmed coronavirus cases are still climbing. The state recorded at least 6,968 cases and 171 deaths, an almost 24% jump in fatalities.
We know we're still heading up that curve, going uphill, but we don't know how high the climb is going to be, how long it's going to take to get there, or when it will level off.
The worst outbreak happened at the Pleasant View nursing home in Mount Airy. Maryland leaders just announced strike teams have provided emergency help to 9 nursing homes and 15 group homes with medically fragile children.
Does the facility have all of the gear in place, all of the protective equipment? Does this facility have the understanding of where to go if any of these children should begin to develop symptoms?
The state also announced a new testing site in partnership with the University of Maryland that can test as many as 20,000 people a day. And equipment will be installed at BWI Marshall Airport that can disinfect up to 80,000 N95 masks each day. As Maryland grapples with a health emergency, the state is also dealing with an economic crisis, a $2.8 billion budget shortfall. The governor announced a hiring and spending freeze. The exceptions are for COVID-19 related expenses and meeting current payroll.
I just put everybody on notice today that it's very unlikely that anything requiring additional spending will be considered to be signed into law.
In order to handle the record number of unemployment claims in the state, Maryland is beefing up the computer servers and doubling the number of people who are answering phone calls. Reporting from the State Department of Health, Mike Helgren, WJZ.
Meanwhile, Marylanders who are eligible for unemployment insurance through the state will also now receive an additional $600 from the federal government. Officials say the state will begin to implement the new federal pandemic unemployment compensation by next week. The Labor Secretary also discussed how the state is addressing the overwhelming amount of people applying for unemployment. She urged those in need to file online and to try to file during off-peak hours. Well, the leadership in the Baltimore Police Union has sent a strongly worded letters to its members opposing a city budget proposal to cut pay, furlough, even lay off some members. Right now, the city is facing a major budget shortfall because of the coronavirus. In the letter, the union says the city is looking to make $11 million in personnel cuts. Baltimore is expected to end the fiscal year with a $42 million deficit. Well, antibody tests that would verify whether a person recently had COVID-19 could be available within a week. Dr. Anthony Fauci says having antibodies to the coronavirus could mean someone is protected from getting reinfected, making such tests important for medical and frontline workers. Fauci says it's likely a large number of people had the virus and didn't even know it. Well, the coronavirus crisis is creating a new normal for everyone, and it's no different for those who work on the front lines. Kelsey Kushner spoke with one nurse at Frederick Health Hospital who's sharing what it's like inside the ER.
The things that I'm seeing ever since this has been going on, I get no sleep.
It's a heartbreaking reality those fighting on the front lines face every day.
It's terrifying. You're trying to put a poker face on so you're not upsetting or making your patient feel like you're scared.
Linda Chaffman says as a nurse in the emergency room at Frederick Health Hospital in Frederick County, the stress is high.
So what's it like being inside the hospital?
You're constantly thinking that, are you covered completely? Did you put all your materials on right? Is there anything that, you possibly did wrong that could have, you're potentially bringing out to another room into another patient?
She and her coworkers are dressed head to toe in full protective gear, steps that are necessary to fend off a virus proven to be deadly. But supplies are tight, masks are scarce, and there's a nationwide shortage of ventilators.
It gives me anxiety because what if, we run out and we have an influx of patients like New York or even Italy, like those situations, and we don't have anything.
Chaffman says as someone with an underlying health condition, her job can go from stressful to dangerous.
It terrifies me when I go to work every day. I'm afraid that I'm going to get it because I'm afraid I'm going to be one of those patients that are going to be on a vent.
Although the pressure is high, Chaffman says she finds comfort in her coworkers, knowing together they will get through this.
We are there for each other to talk to kind of calm ourselves and reassure that, we're here for each other and that we're going to work and we're going to make it through together.
And we did reach out to the Frederick County Health Department. They say they are providing the proper resources to the hospital to make sure their staff members are protected. Reporting in Baltimore City, Kelsey Kushner for WJZ.
Soon those who have recovered from COVID-19 will have a chance to tell their story. The state is launching COVID Connect, a place where survivors can not only share their experiences, but also connect with researchers and others who had the virus. There's also an option to sign up for support groups. Nearly 400 people in our state have recovered from the virus, and state officials expect that number to go up this weekend. Well, a federal judge heard a class action lawsuit on how banks give out federal small business loans. Paul Gessler explains what the Paycheck Protection Program is and why local businesses are suing to make it easier to access money.
The Paycheck Protection Program approved nearly $350 billion in government-backed loans meant for small businesses to cover 8 weeks of payroll and other expenses.
Unfortunately, the banks were the ones that were supposed to administer it. But it wasn't their money. It's Treasury money. It's your money. It's taxpayer money.
Alan Rifkin is part of the team suing one of those lenders meant to administer the money. Bank of America is prioritizing some businesses based on lending relationships, forcing business owners like Yasmin Young to wait.
I was hurt, I was upset, and then I was mad.
Young has been in business with the bank since before she opened Diaspora Salon in Charles Village, but she didn't have a Bank of America loan, so she couldn't get that PPE money.
You have the ability to be a beacon of hope for people like me, and you are choosing to not do that.
The bank said many other lenders chose not to participate in the program at all. In a brief filed Thursday, Bank of America argues beyond setting minimum eligibility criteria, the act nowhere prohibits participating lenders from determining how best to prioritize to whom they will lend under the program.
It feels gross. I'm almost disgusted by it because Bank of America says that they prioritize small businesses.
Senator Ben Cardin called the bank's priority an artificial barrier and redlining by another name. Since filed last week, attorneys say they've received 61,000 requests to join the class action lawsuit. That federal judge Friday did not issue a ruling in that restraining order argument, saying that she would do so in writing as soon as possible. Bank of America attorneys argue they are prioritizing clients who they have lending relationships with to speed up that process. I'm Paul Gessler for WJZ.
Well, WJZ has everything you need to know about the coronavirus pandemic all in one place. Go to WJZ.com and look under the top stories for a list of resources. Plus, the most important links and numbers are under quick links.